Good evening. Um, Hopefully by now, this is your new look anywhere you're out in public. You've got your mask on. You know what to do as far as hand hygiene, as we talked about last time. But let me just introduce myself. I'm Dr. Rizk. I'm here to represent the Fauquier County Employee Wellness Center. And I just want to take this opportunity to speak on behalf of our team and to share a few things about what's been happening currently. So I was out earlier this afternoon, the grocery store, and I could see a lot of people wearing their masks and trying to keep their distance, and so I just want to say to everyone who's been doing that, thank you for doing what you need to do during this time. There's a lot of information out there, and I just want to be able to help sort through what's going on here. So as I'm talking today here, today's April 10th. So the numbers as of today, of course, are going to be different from when you're watching this video or maybe even a few hours from now. But as of now, we've got over 500,000 positive cases in the U.S., over 18,000 deaths that have been reported. In the state of Virginia, we've had 4,500 cases so far and 120 deaths. Again, that's as of April the 10th. So what does that tell us so far? So one thing that they talk about when you're reading some of these articles is the case fatality rate. And so far what we've seen is in New York, that's been up to 4.5%, right? 4.5%. For the state of Virginia, that's been 120 cases and the 120 deaths in about 4,500 positive cases. That's a 2.6% case fatality rate. Overall, in our nation right now, we're at 3.6% case fatality rate. But what does that really mean? Well, we've kind of predicted early on with COVID, kind of around early to mid-March, that it's going to be around between 2 to 4%. But what we've now seen that the case fatality rate has been anywhere between 2% and upwards of 10%, maybe even a little bit more than 10% in some countries. So I don't want to just talk about numbers in the United States, but just to have an idea of there's a lot that we don't know about COVID, and this could hit us at a very low percentage, but it can also be as much as New York or as much as other countries have been hit with this illness. But one of the common questions I have received lately is, well, when can I go back to work? And when can we go back to normal life? This is just kind of getting old now that we've, had several weeks of this. And then even some of the stuff that we're hearing in the media, about reopening the country or, getting the economy back to where it was a couple months ago. So just in light of that, I want to maybe talk about the peak that we're seeing in New York right now and what we expect to see in the state of Virginia. So what does that mean? So when we talk about the peak, we're talking about in an epidemic or in a pandemic that we're seeing right now is that the highest number of positive cases that we're seeing over time. And we've seen some articles that have talked about that peak potentially being reached around maybe anywhere from April to May, maybe even end of May in the state of Virginia. And as you've seen right now, New York is going through that peak and probably coming off that peak a little bit. Now they're seeing a little bit of stabilization in the number of cases and number of deaths that they're seeing. And I'm talking about the rate, the rate of increase that they're seeing. But, either way, will will it be like New York here in Virginia? We don't really know, but we know that a few things about Virginia. We know a few things about Fauquier County that we can probably speak of. We don't have a subway system. We're in a county of 650 square miles, so we're pretty spread out to begin with. We've already kind of lived in more of a socially distanced environment to begin with. So will we see the same peak? Will we start seeing that towards the end of April or May? Well, we don't really know, but there's a lot of factors that can probably affect that and can probably even shift that curve a little bit sooner or maybe perhaps later. And that all is going to depend on how well we're doing with the social distancing and our hand hygiene. Okay, so there's a lot we don't know. And the more that you read about COVID, we don't know why kids are not affected to the same rate that adults are being affected. Whether it's because they're not getting as sick and we're not testing, whether they're acting as a vector and they're not manifesting any symptoms. Last time I talked about asymptomatic spread, meaning people that are not having any symptoms but are still spreading the illness. There's a lot that we don't know. And for that reason, that's why we're encouraging that everybody, takes this seriously and wears their mask when they're out in public. I know that the CDC made this a mandate just about a week ago or so, that everybody that is out in public should be wearing a mask to protect themselves, but also to protect other people. So, in light of all this unknown, I know that this causes a lot of uncertainty and a lot of unrest, but I just want to point out, that there's a lot of things we don't know, but there's the one strategy that we know at this point, okay, is that practicing social distancing, okay, practicing hand hygiene, and wearing our masks, okay. These are 3 measures that we know that will certainly limit the spread of this illness in our country. We want to take that seriously, okay? When we're wearing our masks, we're being an example to others, okay? When we have these things on, it's not in an unfriendly way, that says, well, I want to protect myself from what you might have, but rather, I might have something, okay? I may be spreading something to someone else, and I'm going to put this on because I want to make sure that they're protected. I want to make sure that other people know that I care, okay? And by doing that, I think that's really going to help us slow this down, okay? There's a lot of questions, like I said, there's a lot that we don't know, but I truly believe that we are going to be able to really reduce the impact of this illness if we're doing this together. Okay, this is not a few people that have to wear this. This is everyone. Everyone has got to be on the same page. Okay, I know there are a lot of questions. Please reach out to our clinic. That's what we're here for. Our team is just waiting to answer any questions or just help in any way that they can. So please reach out if you have any questions. We're happy to help. And again, thank you very much for those that have been leading by example, doing the right thing during this time. I know it's very hard for everyone. If you can please just give yourself, a few hours, away from the news, where you're able to do something with your family, just something that just allows you to disconnect and realize that there's more to life than COVID. Okay, I think it's really can help us all get on board and just kind of see things a little bit differently. Thanks again for everything you do. We're here for you, and happy to help.